What are the best dental products for cavity prevention? Let's talk. Hi everyone, my name is Whitney and I'm a registered dental hygienist here to talk about dental products for cavity prevention. And I'll be linking all the products that I mentioned in the description box below. Starting with number 1, floss. Listen, I know it's weird to say floss before a toothbrush, but cavities between the teeth are the most common type of cavities. Mostly because a good amount of people just don't floss at all. So if you're cavity prone, flossing is non-negotiable. And before I mention any specific products, I need to stress the importance of technique. Technique matters a lot. I've seen so many patients who were truly flossing every single day, but still getting cavities because they weren't flossing correctly. They were doing it wrong. So make sure you're using proper technique. I will link my how to properly floss video in the description box below to confirm. Now for products, I personally, for myself, prefer the non-waxed floss because I feel it can really scrape against the sides of my teeth, thoroughly removing any plaque stuck between and disrupting the biofilm layer. However, floss is not a one size fits all. If the waxed floss works better for you, you can get it through all your teeth better, then use it. Some people need to use the waxed instead of the non-waxed because the non-waxed can fray and break and get stuck between some people's teeth. It just depends on your teeth and how they are situated in your mouth. So I will link below some of my favorite options of both the waxed and the non-waxed. Something else to note, if you're cavity prone, this is the one time I would not recommend using only a water flosser. You really want to use the string so it touches that spot where the two teeth meet. We call that spot the contact area. Now for gum health, for gingivitis, yes, absolutely you need a water flosser. But for cavity prevention, it's not needed. However, if you have one and or want to go big and do literally everything you can to reduce plaque buildup in your mouth, then yes, water flossers can be great if used in addition to string floss, but not as a replacement. So you get it. If you want to double up and do both string floss and water floss, go for it. But water floss alone usually isn't enough when we're talking cavity prevention. It's much more important to make sure you are string flossing daily, consistently, and flossing correctly. Like we mentioned, proper technique is more important than the tool itself. So the sawing motion, the back and forth motion, they show this motion a lot in the movies and TV. This is wrong. What you want to do instead is make a C shape against each tooth. Hug the tooth and gently slide it up and down on both sides of the teeth. The string should actually disappear under your gums. Again, I'll link my flossing tutorial video below, and I'll also link my free oral care guide as well, since it contains all my tutorial videos in one place. Next, you know it, a toothbrush, specifically an electric toothbrush. So just like with floss, the number one cavity prevention strategy is physically removing plaque from your teeth and disrupting the biofilm layer daily. This is done by both brushing and flossing. Yes, cavities are super common between the teeth, but they also happen on the fronts, backs, and chewing surfaces. So this is why I often encourage an electric toothbrush if you are cavity prone, whether you like sonic or oscillating, both are great. What matters most is what you'll use consistently, twice a day for the full 2 minutes each time. I always tell my patients, just like floss with the waxed versus unwaxed, use the one that works best for you. However, with electric toothbrushes, I know it's hard to know which one will work best for you if you haven't tried them both to compare. It's much easier to buy both types of floss to see which one you like better, but electric toothbrushes are more expensive to just buy them just to try them. So my best advice is, with the sonic one, which is usually shaped like a regular toothbrush, it vibrates. This one is probably a better transitional electric toothbrush to try if you're used to using your regular toothbrush. Lots of people love a sonic brush, but if you struggle with getting far back there, trying to reach your molars, it's sometimes worth trying to use an oscillating brush because they are usually designed with a smaller circular brush head and longer handle, so you can really reach far back there where you need to get it. However, again, with both, you just want to make sure you're using them properly, guiding the bristles along from tooth to tooth, allowing the electric brush to do the work for you. I also have my how to use an electric toothbrush tutorial video, which I'll link below, which is also included in my free oral care guide. And of course, I'll link some of my favorite electric toothbrushes, both oscillating and sonic, below as well. I personally like using both. I use a sonic in the morning right when I wake up and an oscillating in the evening before bed, and I've been traveling with a sonic right now, I think. My point is, they are both great. Obviously, I get lots of samples in my line of work here, and I truly like both, so use what you like. Now, if you're hearing this and you're like, no way, I hate great electric toothbrushes. All of them. I get it. If you're not ready to switch over yet, just make sure you're using proper technique with your manual toothbrush. You can clean your teeth just as good with a manual brush if, and only if, you're using proper technique. But let's be real, it is a little harder to use proper technique with a manual and a lot easier to get that consistent clean with an electric, since electrics do the work for you. There's less chance of user error with electric toothbrushes, and if you're cavity prone, you don't want any chance of user error. So that's why I recommend electric toothbrushes for those who are cavity prone. Either way, I'll link all my tutorial videos below because technique, again, is what? More important than the tool. Next, number 3, cavity prevention toothpaste. If you're cavity prone, you need to be using a cavity prevention toothpaste, aka a fluoride toothpaste. Fluoride helps remineralize tooth enamel and protects your teeth in acidic environments, like when you eat sugar or carbs and the pH drops in your mouth. The more acidic environment in your mouth, the more likely you are to get cavities. Fluoride helps prevent that from happening. Now, if you're against fluoride, it's a personal choice. I'm not coming at you. So I will link my video about nanohydroxyapatite toothpaste below. It's a decent alternative to fluoride, but it's important to be transparent about how fluoride is better and safer because 1, fluoride works in environments as acidic as pH 4.5. Nanohydroxyapatite only down to pH 5.5, meaning it just doesn't protect your enamel as well. And 2, fluoride is regulated in the US, so if you live in the US, you know you're getting what's on the label of the tube that you're buying. Nanohydroxyapatite, not currently regulated, so it's a bit of a gamble product-wise. Having said all of that, I will link my favorite fluoride toothpaste that I recommend to my patients, and I know many people are interested in SLS-free and no dyes, as clean as you can get. I'll link all the options below, but again, when it comes to toothpaste, just like floss and just like your electric toothbrush, use the one that you like. When you're using a toothpaste that you like the taste of it, you're more likely to brush for the full 2 minutes. And the full 2 minutes is so important regarding cavity prevention. But yeah, sometimes it's trial and error to find the flavoring and texture that your mouth likes. So I usually recommend to first try an anti-sensitivity toothpaste because they tend to be the most mild and they are great for not only those who have sensitive teeth, but also those who are cavity prone because the sensitivity toothpastes have a lot of enamel strengthening ingredients, which can help make your teeth strong and help combat both sensitivity and cavities. If sensitivity toothpastes are too mild for you and you want more flavor, I will link a bunch of other anti-cavity toothpaste options below. If you don't like mint, there's a bunch of different flavors out there as well. I've been using a strawberry toothpaste lately just because it's so yummy and fun and different. Anyway, be sure to check the description box below for my favorites. And again, all the toothpastes that I link will contain fluoride because they are regulated, meaning they are proven to be safe and effective. If you choose to not use fluoride, make sure to talk with your personal dentist and or dental hygienist about what other options can be a good fit for your individual mouth. Again, since the only cavity prevention toothpaste that is regulated contains fluoride, it's a lot of anecdotal evidence when determining which non-fluoride brands may or may not work. Number 4, for extra protection against cavities, use an anti-cavity mouthwash before bed. I recommend this to all my cavity prone patients. Just follow the directions on how long to swish after brushing and flossing and don't rinse with water afterward. Let the cavity prevention ingredients in the mouthwash sit on your teeth while you sleep. It gives your enamel a little boost. Side note, some people like to leave the fluoride toothpaste on their teeth after brushing instead of rinsing with a fluoride mouthwash. That's okay too, but the texture just personally grosses me out. I don't want gritty toothpaste sitting all up on my teeth. And there's not a ton of evidence showing that it helps more than mouthwash. So again, do whatever works for you. I will link some of my favorite anti-cavity mouthwashes below. Number 5, this one isn't a product, it's more of just a tip, but swish with water after eating. It's so simple and it's so helpful. Just rinse your mouth with water after eating and or drinking anything other than water. It helps neutralize acids and washes away leftover food debris. It's easy, it's free, it's game changing. And on top of swishing with water after eating, you can also use number 6, xylitol gum or xylitol mints. After meals, especially if you can't brush right away, chew gum with xylitol. It helps neutralize acids and inhibit cavity causing bacteria. Side note, the flavor on most good quality xylitol gum doesn't last very long, but hey, we're doing this for oral health, not for a bubble blowing contest, right? So again, I'll link all my favorite xylitol gums and mints below. Number 7, a tongue scraper. While a tongue scraper isn't going to directly prevent cavities, it can help reduce the overall bacterial load in your mouth, which in theory can help. Plus, it makes your mouth feel fresher, right? So why not? And lastly, number 8, the BetterMouth app. Consistency is everything. Even skipping one night of brushing can lead to plaque hardening into tartar, which sets you up for both cavities and gum disease. Truly, it only takes 24 to 48 hours, depending on your mouth, for plaque to harden into tartar. So skipping just one night means a cavity can start forming. That's where the BetterMouth app comes in. I recommend it to everyone. It's like having your own personal accountability buddy right there on your phone. There is both a free and paid version to help keep you on track with streaks, timers, tutorials, educational content, challenges, and more. I think it's It's so fun. I love it, which is why I am the oral health advisor on it. Overall, cavities are not just about sugar. Of course, eating healthy is helpful in cavity prevention, but cavities are due to a combination of factors: your brushing and flossing habits, as well as your saliva, pH, genetics, and most importantly, your mouth's bacterial makeup. Some people are just more prone to cavities than others, and that's okay. If that's you, don't feel doomed. You're not doomed. It's both nature and nurture. Just because you're prone doesn't mean you're guaranteed to get cavities. Oftentimes, you just need to work a little harder to prevent them. And using an electric toothbrush, floss, anticavity toothpaste, fluoride mouthwash, xylitol gum after meals, and a consistency app like BetterMouth, if you need help with routine building, all of that will help get you there. And again, all my favorite products are linked below, as well as my fluoride versus nanohydroxyapatite video and other supplemental videos if you'd like to learn more. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website teethtalkgirl.com and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.